Access to a waiting list is not access to health care. Close quote. That's a profound statement for Canada. That is an amazing statement. It is a recognition and a resignation that the system is failed, and that creating lists of people and trying to create this kind of rationed access is a failure. And it did it on a very important principle. It did it, the decision that it came to, based upon the Quebec Charter of Human Rights and Freedoms. In other words, not getting health care is a human rights violation, according to them. Unfortunately, even though they said that, the decision was stayed, and nothing has happened since then to improve the healthcare system at all. I wonder why. Because the government runs the system. So what does Canadian healthcare really mean? Canadian healthcare is a government monopoly. It is a socialized, fascist, communist, central command system. Doctors and patients are criminals in this system. They're the bad people. Private insurance for covered services is illegal in Canada. You cannot buy it. It doesn't exist. Doctors who accept private payment for covered services are criminals who are fined, jailed, and stripped from their ability to ever practice medicine again for you. Nobody knows in Canada what your doctor is really worth. Nobody knows anymore. They blurred the line. It's just a job. But if you think that's bad, what about the patient? Well, patients are also devalued. You're a chart number. You're a commodity. You're not a person, because that's not relevant to the cost. That's not the issue. There's no personal care. You don't get attention. The care is dictated by a system, not by need. What happens in Canada in the long term when you keep going at it like this? Resignation and acceptance, because you have no other choice. So you accept the lesser system, and then when guys like Michael Moore go to Canada and say, "Are you happy with your system?" everybody says, "Yeah." But that's like going to Ethiopia and asking if you're happy with your loaf of bread. Everybody will be happy with what they have, because it could always be worse. But that's not a measure of the quality of the healthcare system that you get or anything else. Happiness is malleable. There have been lots of studies on happiness. We can be happy with nothing, if that need be, and we'll still say we're happy because we're still not dead. Happiness is a terrible measure. So when people come out and say Canadians are happy with their system, I have relatives in Canada. They go through that healthcare system. They say they're happy. I sit down and laugh. That's silly. You can't be happy when you get this, when I say we can get this, and then I can barely be happy. How do we reconcile that? Because happiness is a terrible measure. Don't use it. Don't believe it. It is not a good measure of what you get in terms of your healthcare system. It's a relative term, and it's dictated by time and circumstance. Most critically, the most critical issue in the Canadian healthcare system is that the doctor-patient relationship is severely disrupted. It is significantly interfered with and significantly devalued. And that relationship is the critical element of all healthcare. No matter what anybody says, the doctor-patient relationship is the key to your well-being when it comes to health. What happens in Canada as well? A doctor shortage. Canada has the second lowest doctor-patient ratio after, guess what country? Japan! Japan. Go figure, right? Japan. Because they accept in Japanese culture the fact that you can be sick. In cultures where it's acceptable, where you have to accept the consequences of whatever comes your way and humility and all that, if that becomes a cultural norm, it will exist. And you can keep cutting back. And that's what happens. And that's what happened in Canada. In Canada, you have to have, as I said, a primary care physician to get into the system. You can't get a specialist without a primary care referral because the specialist is punished. You can't call up and say, like we heard the story a little bit earlier, I want to see I sort of have a back thing going on, and you're a really good surgeon. I saw you on the internet, and I really want to come into your office. Okay, we can book you in at 3 o'clock this afternoon. Can you come in? That's here. In Canada, you can't do that. Hi, I want to see, have you seen your primary care physician? No? Well, you have to see your family physician. We can't see you. Why won't the doctor see them? Because the doctor won't get paid. Because without a referral that you can document and prove, you can't make this up. You have to prove, you have to get like handwriting stuff to you from your primary care physician to the specialist in order for you to see the specialist. And absent that, the specialist will not see because they won't get paid for the service they render. That's the kind of control they exert. So what does that create? You heard. Waiting lists. Long lists. The caps on fees and income are significant. Because when your income is capped as a provider, or when the fees are limited for a service, you're not going to provide them if you can't afford to pay for them. So in Canada, as I said, we have these global budgets. When doctors have billed to the maximum of what they're technically allowed to earn within their specialty and experience, etc., they don't get paid anymore. When you stop getting paid, you're not going to work. And they don't. They shut their office. So even if you had a doctor near the end of the year, that doctor may be around because they've earned what they had to and they're done. So caps are severe and significant. So they limit availability, they limit practice hours, and they limit access. What's the other consequence? Well, if you need a primary care physician to do things, you can't get your primary care physician and you get sick, where do you go? Only one place, the emergency room. That's the only place you can go in Canada. Like I said, there are no intermediate facilities like our walk-ins and stuff like that. So you end up in the emergency room. So as the emergency rooms fill, long wait times. You end up languishing in the emergency room, which does two things. One, you don't get better, but the real sick people, they get worse. So real emergencies can't be handled as they back up. And this is the substitute for absentee physician access. Another consequence of the Canadian healthcare system, reduced medical school sizes. After all, if you don't want a lot of doctors around, what better way than to stop them from actually getting into medical school? Good idea. So, less doctors graduating. Outcome of that, though, is a doctor shortage. Wow, what a surprise. So you can't get to see doctors. As a former Canadian physician, they beg me now to come back to Canada. They will pay me extra over Canadian physicians to come back because nobody wants to practice in my province of Ontario. I can make more than my colleagues just having left, so I can go back. The other consequence of that is that who ends up going to medical school? Well, people who are less interested. The less qualified candidates. After all, if you're really qualified and you're really smart, and I will tell you now, not to brag about me in particular, but the smartest people in society, the best trained, the most critical thinkers in society are doctors. Nobody has had more education in society than doctors, especially specialists. Okay? By the time you're finished school, most doctors are in their 30s. And they have been to school for 25 of those years. It's a long process. They're extremely highly skilled individuals. However, if you're that skilled, why would you bother if you can be something else, like a lawyer, or an engineer, or a politician? Anything could be better. Many things are. And so the best and the brightest don't go to medical school anymore. That has led to another consequence. Increased numbers of foreign medical graduates who do the job the Canadians no longer want. Unfortunately, foreign medical graduates graduate with lower medical standards and have this constant focus on medical social justice. They help promote the system, and they don't know anything different. So they work to do what's good for society, so the patient becomes even less relevant. What does that lead to in the end? Part-time doctors. The number of part-time doctors in Canada is burgeoning. Why work full-time if you're going to end up taking the year off anyway? Doctors have 2 careers, particularly women doctors. It's nice. The women's lib movement has been very powerful in Canada. Lots of women doctors. They work part-time. You know, put in 20 hours a week, shut your door, you're not responsible for anybody, doesn't matter. It's not the kind of commitment that you expect out of doctors who make this a career. It's just a job. And then other doctors will do it part-time and have another career to do something else, run a business or do something else. We talked about doctors. What about nurses? Same problem. Huge nursing shortage. Who wants to be a nurse if you can't be guaranteed work? If you're busy shutting off hospital wards and you don't know if the emergency room is going to be open or closed, you don't know if the delivery room is going to be open or closed, you don't know if you're going to be working. So there's a nursing shortage in Canada as well. All of this is because of the rationing that occurs with limited access to doctors, specialists, treatments, hospital beds, and technology. The consequence of which is prolonged waiting times, progression of illness, progression of impairment, progression of disability, and increased costs to the healthcare and welfare system. The Canadian healthcare system is not a healthcare utopia, but rather a social, non-free market dystopia that fails in its fundamental underpinnings and punishes those stuck in the system who are not politically connected or wealthy enough to seek healthcare outside of Canada. The Canadian healthcare system and the American healthcare system are 2 extremes on the continuum. A tale of 2 systems, so to speak. The Canadian worst of systems, with denial, delay, and total lack of accountability. And the American, the best, but a wastefully abused system. What is the biggest healthcare expense, do you think, in our American healthcare system? What?
Medication.
Nope. Nope.
Bureaucracy.
Bureaucracy. That's right. In America, the largest healthcare expense is also the greatest source of waste. Bureaucracy, administration, and regulatory micromanagement. How much do you think that costs? What do you think? Any ballpark ideas as a percentage? Close. Pretty close. 1/3. 1/3 of our costs in our American healthcare system are due to bureaucracy, administration, and regulation.
That include the insurance companies, bureaucracy, or only the government?
Everybody. Everybody. It's all the same. It's still 1/3. Everybody.
Did you say bureaucracy?
Administration and regulatory micromanagement. Now, remember the number I gave you. I gave you a number, right? 16%, right? Remember that number? Let's take 1/3 off of that. When we take 1/3 off of that, what do we get? About 11%. What number did I give you for Canada? 10.1. Get rid of the bureaucracy, and we wouldn't cost anything more than Canada virtually. Except we wouldn't be at all like Canada, because we wouldn't have all that limitation and restriction. Indeed, pretty much all socialized systems, of which almost all world healthcare is right now, runs between 8 to 10% of GDP. Just imagine getting rid of the bureaucracy alone and the regulation. So, now let's talk a little bit about the Patient Protection and Affordable Care Act, which I call an oxymoron. We call it Obamacare. So let's understand this a little bit, because to understand how to really reform the system, now we understood what Canada's all about. let's understand a little bit about what America is about. What are the fallacies on which the Patient Protection and Affordable Care Act, PPACA, or Obamacare are premised on? The pressure to reshape healthcare in this country has been founded on 3 fallacies of crisis. First fallacy is the fallacy of the uninsured. According to the National Center for Health Statistics, the percentage of Americans under age 65 without health insurance in 1994 was 17.5%.